Welcome to the Healthy Perspective Podcast with your host, chiropractor, entrepreneur, mentor, and author, Dr. Chris Bowman. He'll break down and extract the secret sauce behind his own success and the success of some of the top leaders in every category and from around the world. Get ready for your weekly mental adjustment because shift is going to happen.
Hello, everyone. Welcome to another episode of the Healthy Perspective Podcast. Today is going to be another Spitfire episode. I hope it's going to be helpful for you parents and especially new parents that are navigating the world of raising kids, especially kids when there's so many conflicting medical advice, there's so many new things going on. Raising kids now is definitely not like raising kids even 5 years ago, but definitely not 10, 15 years ago. Today we have Dr. Michelle Young. She's a licensed naturopathic doctor and owner of Young Medicine, a family-focused medical clinic. Dr. Michelle received her Bachelor's of Science at the University of Michigan before receiving her Doctorate of Naturopathic Medicine from Bastyr University, California. She specializes in preventative and chronic childhood cases and feels like she has the best job in the world. Her vision is to create a healthier world for children and families using naturopathic modalities, to provide accessible, effective, and individualized pediatric care, and to be a source of education and guidance for her community, reducing childhood illnesses by equipping families with the knowledge and empowerment to be proactive about health. I feel like besides the naturopathic medicine, my vision and everything is exactly the same. So I was super stoked that Dr. Michelle and I were able to connect. So thank you for joining me.
Yeah, thanks so much, Chris. I'm so excited to be here.
You know, we originally connected. I had a couple of patients say, oh yeah, I have a doctor in San Diego. We're getting a ton of families moving from Orange County, San Diego, LA to our little kind of more suburb community. And after the third or fourth patient, you kind of start to pay attention. And so I reached out. I love what she's doing. And I figured, you know what, let's connect. What better way to connect over a podcast so people can hear the type of conversations that we as healthcare providers, especially focused in the pediatric world, get to have together. So Dr. Michelle, why don't you kind of just cue us in on your story? What got you interested in medicine and then the natural medicine route and then more specifically pediatric care?
Yeah, absolutely. Thanks so much for that warm welcome. So I grew up in the Midwest. I grew up in a not so, I wouldn't say healthy family dynamic. My lifestyle was not very healthy. My environment was not so healthy. But I always was very interested in kids, and I was also very interested in health. My mom was an ultrasound technician, and I grew up, if I was sick, I would go in and I would go into her office and as she worked. And so I was very often around medical professionals and different doctors' offices. And that kind of led me to wanting to become a physician. And I found myself at the University of Michigan. I was really heavily involved in their pre-med program. And I slowly began having some really severe symptoms that kind of gradually got worse. I had a lot of anxiety. I had a lot of anxiety symptoms, heart racing, stomach tightness, but I also had really, really bad GI symptoms that kind of came to a peak I think it was my junior year of college. And finally I was like, I just have to figure out why this is happening, right? Like it was starting to affect my daily life. And so I kind of did what I knew to do. I went to see my PCP. They really didn't offer any solutions. They were like, you have IBS, here's some Miralax. And kind of, I didn't question it, right? I just did what they said. And I took the Miralax. It really didn't help. So then I ended up back in the PCP's office. And then I ended up seeing all of these specialists, and really they had the same answers, which were not true answers. They were blanket statements. You have IBS and here's some Miralax and maybe cut out dairy to see if that helps, and just like sent me on my way. And I think really intuitively, I knew that just wasn't a long-term solution. I thought that was ridiculous. And so I kind of went on my way. And then one of my friends kind of simultaneously was also dealing with his own health concerns, and he was seeing a naturopathic doctor in Michigan, which at the time was a pre-licensed state. And I had never heard of a naturopathic doctor. I really thought it was really dumb, to be honest. I was like, who is this wacky doctor? I've never heard of this. I was very skeptical.
What do they tell you to go hug trees or something?
Yeah, I know. I was like, these people are not real. They don't do real medicine, is kind of what I thought, to be honest. But I was desperate. I was like, I can't keep living my life this way. And so I reached out and I got into her office. And I remember leaving that first appointment in tears. And I remember calling my mom and being like, oh my gosh, this is real medicine. This is true healthcare. And I had never been listened to so deeply in my life.
Wow.
And really over the next about 6 months, I radically shifted my lifestyle. I really focused on stress management. I changed up my diet. She added on some herbals, really basic recommendations. Now that I'm a naturopathic doctor, I look back on what she gave me, and it was like the most basic recommendations, and it radically changed my life. And so I started having these thoughts of like, oh my gosh, allopathic medicine maybe isn't for me. And during that time, I was working in a pediatric research lab at the University of Michigan. And I was, rubbing shoulders with a lot of fellows that were new docs. And I started asking them questions, like, how do you like your job? Do you feel like you're making an impact? What has your daily life been like since you got into this? And every single one of them that I talked to and shared my story with said, don't do it. We would not suggest going down the road that we have gone down. And that really struck me. Like, it still really gives me goosebumps, because I really took to heart what they had to say, because they were new docs. They were fresh out the gate, right? And you would think that these new docs would be so excited about their job, excited about their impact. And they weren't. And they said, I would look at some other avenues.
Wow.
And so I started preceptoring with the local naturopathic doctors. And I knew immediately this was the path. This was the path that God was sending me on, that I had no idea was even out there.
Wow.
And so I took a year off after I graduated, and I ended up working in a primary care facility that, again, kind of reinforced that the allopathic model was just not for me. I think I also began to see that the allopathic model is very important. We don't have to choose between the two.
Yeah.
There is a time and a place for that allopathic model, but I did not see me in that allopathic model.
Yeah.
And so I shifted, and I moved out to California to attend Bastyr University for their naturopathic medical program. And I love it. I love it. I see the radical shifts that the parents that I work with make. And yeah, I can't wait to dive more into it, but that's kind of how I got into natural medicine. And I really do feel like I was guided. This is like the purpose that God gave to me in this world, is to share about naturopathic pediatrics and work in this more naturopathic world, to be more of like an upstream solution to our craziness in this world.
Right.
Yeah.
That's so good, and I think it's a relief for a lot of moms, or, even students, people that are, lost, and they know they want to help people. The only kind of frame of helping people that our Western culture gives is like, well, you go be a doctor, and I think you're right. I think there's a lot of people that are in the field now or in the middle of school that just don't resonate with the things that they're being taught. They recognize that the medical system is broken. It's been bought by people that their customers are the stakeholders, not necessarily the people that they're actually dispensing the medications too. And you can see that with, what is it, Johnson and Johnson is like the biggest felony crime against them, like $10 billion fine, and every top pharmaceutical producer has some sort of charge against them, billions of dollars in fines, but that's to them less than they spend on marketing. And I think even if you look at the money they allocate towards research and marketing, at least in the United States, marketing outpaces it like 3-1. And so you start to look at, they're not necessarily telling the story that is actually going to be helping people. They're telling the story that gets people into the system. And how you make more money as a business owner, you get people to come, continue to buy, and start to buy more. And so when you start to look at, you give someone a Miralax, or maybe, I don't know if you see pregnant ladies, but I'm seeing a lot of problems right now, people being low in iron. And so they recommend like iron infusions, which makes you constipated. And then you're on Miralax. And then, it's just one thing after another. And then the kid, for some weird reason, has colic or reflux or, all these sort of things. And then you get them on, Zantac or Prilosec or, all these things right from the get-go. You don't breastfeed your kid, or they're being for, cesarean section, and then they have antibiotics, and you look at the whirlwind of the toxic load that our parents and that our kids are facing today. It's no wonder so many parents are stressed out, feeling like failures. So many kids are developing differently than what we're used to seeing. And so I'm so thankful for you that you can, actually have a conversation with these parents and be real with them and hear their story. And I'm sure, just like my practice, for some of these moms, just being heard is a game changer, because they're just run through the middle of the medical practice because they got sometimes bigger things to worry about, like COVID, or, really, really sick kids, that the little things like reflux or constipation or colic are being overlooked and dismissed when it affects parents' lives massively. I'm sure you've seen those parents where the kids are refluxing, 10, 15 times a day. They're changing their clothes 5 or 6 times a day. They can't go out. And that does a lot to a mom's psyche, What does it look like to visit a naturopathic, practitioner? Because I'm sure a lot of moms have a very similar view as you. Maybe they're desperate, but they maybe just don't know, like, what does it actually look like when they call your office?
Yeah, that's a great question. And it may look different. So every naturopathic doctor works a little bit differently, but I'll share how I go about things. So my initial consultations or initial appointments are 75 minutes long. It's a complex new patient, they're 90 minutes long. Wow. And so we spend so much time with our patients. And I think that is, again, when we compare it to the allopathic model, we have time. In 15 minutes, you cannot diagnose. You cannot get a proper, true root cause of, say, chronic constipation in 15 minutes. It's impossible. So in my initial intakes, where we usually start is from conception. Yeah. So I usually start my initial intakes with, hey, tell me the timeline of your kiddo's story from conception up until now. What has happened in their life? What has happened in your family dynamic? And how I treat a lot of chronic conditions. So how have these symptoms progressed, or how have they morphed? Yeah. And then we get into the nitty gritty of each symptom. I go through environmental considerations as well, right? Is there mold in the house? Do you live near a major freeway? Do you live near a major farm, or, somewhere where they're spraying? Do you drink filtered water? And then we go through what we call the determinants of health. So nutrition, we go through in great detail. What is your child eating? What is your family eating? Where do you get your food? How do you prepare the food? Then we talk about sleep, movement, connection, stress. How are they doing at school? And then I talk a lot about connection and community with my parents. And what I'm finding more recently is this conversation is even more needed. Parents are feeling so isolated. Kids are feeling so isolated. And we need to bridge that gap. And so I find that that's very important to speak with each of my patients. And then physical exams, I am 100% virtual right now, but when I had my in-person practice, then we would do a good full physical. And then at the end of the visit, we discussed, what are my thoughts? What are some possible root causes? Say if your child is coming in for chronic eczema, what are some possible root causes that I'm kind of piecing apart from what we just discussed? And then what labs am I requesting? So in my practice, I do kind of the traditional serum labs, but I also use a lot of eclectic testing. So things like food sensitivities, food allergy testing, stool tests. I run a lot of comprehensive stool analyses. These are different than, say, your pediatrician would order. I run a lot of organic acid tests, which is a urine test. And then at the end of the visit, we kind of discuss my initial thoughts. And then within about 72 hours, I send a comprehensive treatment plan with really nutrition, lifestyle, supplementation recommendations, and then any referrals that I'm recommending. And so it's really in depth. And what I like to remind patients is this is true individualized medicine. You're not, I have no protocols, I have things that I know work for different things, but it's true individualized medicine. I could have 5 eczema patients and they will have 5 completely different treatment plans. And that's the beauty of naturopathic medicine, right? And so is kind of what it looks like. Looks a little bit different depending on what you're coming in for. But I treat, everything from acute concerns to chronic eczema, chronic constipation, autism, kind of across the board. I see it in my practice.
Now, when you're going through, especially the, nutrition and those sort of things, let's say you take 5 new patients, across the board, different things. How much of this stuff is new, and how much of it is just like, I didn't realize how much of an effect this stuff had on my kid. I didn't realize food dyes, or I didn't realize sugars, or those sort of things.
Yeah, it's a good question. I have kind of 2 different patient populations. I have the patient population that is so incredibly informed and educated, and they do a lot of their own research, and they have already maybe removed the dyes. They maybe already make their own sourdough. They're, eating mostly home cooked meals. And so some of those patients, we're making more minor tweaks that are more individualized. And then I have the other kind of patient population that, the more natural world is more new to them. And I love working with these patients too, because we can make such a big impact. And for those patients, it's oftentimes what I see is big aha moments of, oh my gosh, I had no idea. Sometimes we will just start with removing, say, food dyes, or removing pasteurized milk, and then we'll reintroduce, say, raw milk, and they'll have wild responses, right? Of like, oh my gosh, I had no idea that food could be this impactful. And so I kind of see both. Some of it is completely new information. And then with other patients, we still have to make some dietary interventions, because I like to remind patients that dairy isn't bad for everybody. Gluten isn't bad for everybody. I don't believe that every single person on this earth should be off of gluten, off of dairy, off of X, Y, or Z. However, there are things that kind of across the board are pro-inflammatory, or, are gut disrupting. Things like food dyes, or, heavily processed foods, in trying to limit those within the home. I call parents the gatekeepers of their house. So I tell parents, you don't want your kids eating, that ice cream that's filled with dyes and processed milk and all of these things, then just don't buy it. Right? You may have it at school every once in a while, or birthday parties, and that's okay. I am pro balance for sure. But if you don't want them eating it on a regular basis, don't buy it. Don't do it. Don't bring it in.
Easy as that, right? And you save on your food bill.
Totally.
I had a patient, I still see him. Apparently he puts ketchup on everything, like everything but his dessert pretty much is being ketchuped, and struggle with like focus and, those sort of things. And I said, have you checked your ketchup ingredients? And they're like, isn't it all the same? And I'm like, no, some was made with high fructose corn syrup and food dye, some is not. And she's like, what? And so she checked, and she's feeding him the high fructose corn syrup, food dyed ketchup. And I'm like, change that. Like, you don't even have to stop giving him ketchup. Like, just give them the organic stuff with, no sugar and that sort of thing. And almost overnight, it's like, oh my gosh, my kid is focusing better. Like, oh, and parents are so eager to in a sense, displace, like, this couldn't be that's causing the issue. Like, something's wrong with my kid. I need something to, I don't know. It's like so difficult. It's sometimes for me to bridge that gap between like what we put in equals what we put out. And it's probably the narrative that, that medicine kind of puts out. But it's so interesting that, people are willing to believe that, because, and when I get parents that are, especially the dads, that are sitting like this and like, don't believe anything you're saying. And, so you're telling me if I take this and this out, it'll make a difference. And I'm like, well, yeah, like, have you ever had alcohol? And I'm like, well, of course. I'm like, have you ever had too much alcohol? And of course. Did it impair your judgment? Did it change your personality? Well, yeah. So what you put into your body can influence the way your brain functions. And then they're like, oh, that makes sense, but they just don't want to believe that these little changes can make such a big impact. That being said, how is your relationship with a lot of the pediatricians that I'm sure you co-manage with, or, whatever, or do a lot of the parents come to you because they're kind of done with the advice that they're getting from there and want something new? I don't know, or I'm sure there's a mixture of both.
Yeah, there's a mixture of both. So as a licensed naturopathic doctor in the state of California, I'm not considered a primary care physician. Yeah. So all of my patients have to have on record a relationship with another pediatrician.
Oh, interesting.
However, I will say a lot of my patients do use me as, say, their main doctor.
Yeah, okay? Primary portal of entry.
Yeah, probably similar to you. And there's also a mixture of how pediatricians respond to the care that their patients are receiving. I try to be very open with my patients. And what I actually find works a lot better, say, if I was running, say, serum labs, basic labs, the patient would be paying out of pocket if I ordered them. If their pediatrician ordered it, it would be covered by their insurance. And so a lot of times I'll say, hey, to my patients, go request these labs from your pediatrician. Okay. That oftentimes works a lot better than if I contact the pediatrician to ask them to order it. I find that having the patient do it works a lot better. Yeah. And I think there are some dynamics there, right? And I think there's a lot of educating to still be done about our licensure, our education, and our training for pediatricians.
Yeah.
Also, a lot of pediatricians, and I'm sure you're dealing with this as well, so a lot of the pediatricians in California in general will not accept unvaccinated children. Yeah. And so that alone is a huge barrier to healthcare for a lot of my patients. And so they're paying out of pocket to see me exclusively because they want a doctor on board. And I think that's 100% craziness. And so I try to find, there are some really wonderful pediatricians in San Diego that I will refer my patients to, so that they have kind of the best of both worlds, is what I tell my patients. You have the best of both worlds. You can see the allopathic doctor that, will look at your child in one specific way. Then you can also see me, who will see your child from a different lens. And we can meld the two.
Yep.
So they're always bad apples.
Sure. Yeah. And that's what I always try to tell my patients too. It's like, look, I don't believe chiropractic is the one all cure all. I don't believe chiropractic is dangerous for kids. That's my perspective. There's things that I think about the medical system that, like maybe a lack of education or a lack of bad experience, but don't think your pediatrician and I are against each other. We're going to come at it from two different perspectives. My goal is to give you information on both sides, so that way you can make an informed decision outside of fear. And that's what I think is the major thing that connects, is like, don't make your decisions out of fear, whether it's induction, whether it's vaccination, whether it's medication, whether it's this and that and the other thing. Like, never make a decision out of fear. And I feel like that's so helpful for parents, because they feel like, what other choice is there? Either make it out of fear, or I live in fear that the decision that I didn't make, is going to hurt my kids, or, whatever it is. And it's like, it's so backwards, and especially in our age. Like, I could understand 50 years ago when you'd have to read a medical textbook this big to figure out what ear infections were, but now we have so much information at our fingertips, so many workshops, YouTube, Google, all these sort of things that you can gather information and, hopefully, put it together in a way that's helpful. But I appreciate that as well, is we got to make sure that our healthcare system isn't just like pushing some people to the side and saying, we'll take over, from here, even though I feel like we could if they wanted that. But it's like, let's work together and let's see how we can help each other rather than just continually, bash each other. I was telling Dr. Michelle earlier, I'm preparing my workshop for a talk that I'm doing upcoming. And I was just reminded, ear infections. Like, it's the number one reason kids visit a pediatrician. Like 30% of all their visits are ear infections. And there's really no way for a pediatrician to treat it except for antibiotics. And they know that the what is it, the AMA or
70%, are viruses.
Right. And they recommend wait it out, but most of them give antibiotics with the good heart, wanting just to help the kids stop crying and be in pain and whatnot. But if they were just informed, like, hey, go see this naturopathic doctor, there's a protocol that they have that's shown to be pretty effective with the rest of my patients, or go see this chiropractor. In a couple of visits, he's helped 10 of my patients. So, you know what I mean? Like, let's try something different. And you would think that it's like, man, if I could only refer like my rashes and broken bones and things that pediatricians are really good at, and we see all the stuff that's preventable or easily treatable, for lack of a better word, from a natural perspective, I feel like we would be so much better friends, but we'll keep that in our vision for the future. Well, Dr. Michelle, I'm sure we can continue talking for another hour, but I want to be respectful of your time. How can people find out more about you? I'm sure you're booked out a few weeks, but if people are interested in booking an appointment with you, where can they go?
Yeah, absolutely. So I do see patients 100% virtual. I am a licensed naturopathic doctor in the state of California. So I treat patients in California. I also do consultations all over the world at this point. You can find me at youngmedicine.com online, as well as on Instagram. My handle is Dr.Michelle_Young. So don't hesitate to reach out. I love, talking with people and also finding referrals. If I'm not a good fit for you, I'm happy to find someone who may be a good fit for your family.
Yeah. Awesome. Well, thank you so much. This has been a wealth of information. It's been affirming for people. And so I think there's going to be a lot of people that just kind of take a breath of fresh air, like people that think like me, or I've been frustrated. I haven't been getting the answers, and there are other options. There are people that listen. There are other ways to look at my health and wellness besides just, medication or deal with it, or it's in your head. So for those of you that are maybe in that position, exhausted from parenting, search me out, search Dr. Michelle out. There's people that are listening to you. If we can't see you, we'll be sure to find somebody that can give you the care that you're looking for your family. So once again, Dr. Michelle, thank you so much for joining me. I'm looking forward to this episode going live and doing our small part in changing the world.
Yeah, absolutely. Thank you so much for having me.
Thank you for listening to the Healthy Perspective Podcast. To connect with Dr. Bowman, follow him on Instagram at Dr. Chris Bowman. Until next time, make shift happen.